branch of the facial nerve. Remember this. It is supplied by the this is supplied by the posterior auricular branch of facial nerve. Facial nerves branch posterior auricular supplies the posterior belly of the occipitofrontalis muscles. Posterior auricular. Okay, leave it. And the muscle raises the eyebrows and causes the wrinkles in the forehead. Frontal belly, which is present in the forehead, cause the wrinkles in the forehead. Okay, the temporoparietalis muscles is present on the lateral, which arises from the temporal fascia and fuses with the epicranial aponeurosis and is supplied by the temporal branch of the, means this is the temporal branch here, it is supplied by the, it supplies the temporoparietalis muscles. Okay, very simple guys. Just you have to remember these two muscles, occipitofrontalis muscle and the temporoparietalis muscles. And the occipitofrontalis muscle has the two bellies, occipital bellies and the frontal belly. Occipital belly is supplied by the posterior auricular branch of the facial, and the frontal belly is the longer, wider and partly united. It is united and each arises from the skin of the upper eyelid and the forehead and meninges and the orbicular oris, and here's the orbicularis oris, and here's the frontal belly. Here's the frontal belly and arises with superior margins of the orbital, and it is supplied by the temporal branch of the facial, means this is also supplied by the temporal branch of the facial. And the another muscle is the temporoparietalis muscle, and is located on the lateral side, means on the side, and which is arise from the temporal fascia. It is arise from the temporal fascia, and it is supplied by the temporal branch of the facial nerve. Now we get to the third layer, means SCA. So A for aponeurosis. The epicranial aponeurosis or the Galea aponeurotic is the freely movable on the pericranium along with the overlying adherent skin and the fascia. Okay, and interiorly it receives the insertion of the frontalis, and the posteriorly it receives the insertion. We have read this because interiorly frontalis belly of the occipitofrontalis muscle is inserted in the epicranial aponeurosis. Okay, and posteriorly it receives the occipital belly, and it is attached to the external occipital protuberance highest to the nuchal lines in the occipital belly. On the each side, aponeurosis is attached to the superior temporal lines but send down a thin expansion which passes over the temporal fascia and attached to the zygomatic arch. Okay, and then the most important theoretical thing is that which you have to write in the exam. The first three layers of the scalp are called the surgical layers. Okay, surgical layers of the scalp. These are also called the scalp proper also. Okay, the fourth layer of the scalp, we have done this SCA. Now comes to the fourth layer, L, loose alveolar tissue. Okay, it extends anteriorly into the eyelid because the frontalis muscle has the no bony attachment posteriorly to the highest and the superiorly to the nuchal lines, and on each side to the superior temporal lines. It gives the passage to the mesentery veins which connect the extracranial veins to the intracranial venous sinuses. Okay, now comes to the fifth layer. The fifth layer of the scalp is the pericranium, is the loosely attached to the surface of the bone. Pericranium means outer covering of the bone, but it is firmly adherent to the sutures, where the sutural ligament bind the pericranium to the endocranium. So this is the brief description of the scalp. So here is the diagram of the scalp. This first layer is the skin, SC for connective tissue, A for epicranial aponeurosis, L for loose cellular tissue, and P for pericranium. Okay, this is the dipole diploid table, diploid in between outer and inner table of the skull. Okay, and this is the endosteal layer of the dura mater, which we will discuss in the later videos. Thank you.